Basically, you see IntegriCell here, but you should see the Cryoport logo. So we are here in the Cryoport presentation, and you know that Cryoport is a big company, so this is why I have to disclose this disclaimer. And why do we all know Cryoport? Because it's a leading company in everything linked to cryologistics for cell and gene therapy. I think that this is no doubt. Cryoport comes with highly innovative shippers, with highly innovative way to support you in the logistics for your clinical trial and commercial product. No wonder why Cryoport is #1 in the cryologistics. We support more than 600 clinical trials, basically all the commercial products. And if we look into our internal data, this is about autologous. Most of it is autologous, so we know what the vein-to-vein time is, and we know how to take care of your vein-to-vein transportation. For that, Cryoport has built a global network with presence in the US, in Europe, and I will come to that in a minute, and in Asia Pacific. In Europe, it's growing, because we need more in Europe, and we will getting more in Europe. There was an acquisition last year of Celenco, which is a GMP storage facility to help with storing your drug products and also helping with your clinical trials, and there will be more. They will be opening also in the US, and thanks to CryoPDP, which is specialty courier in the field, we have bases all over Europe. What is coming now, and that was the talk also next door, is that there will be an increase in cell therapy programs, and we know that scalability could be an issue. We want the success for your clinical trials. We don't want you to be blocked by a problem in the supply chain. Supply chain is very key. This is why, this is just saying that there will be more this year. This is why Cryoport has decided to help you with more supply chain services, including cryopreservation. So now the question is how a logistic company can support cryopreservation, because they have acquired a company, where I'm coming from, Cell Matters, fully dedicated to the cryopreservation in the sphere of cell therapy, especially focused on cryopreservation of leukapheresis. So what we do, this is our daily job, we cryopreserve leukapheresis. We are opening centers in Liège, Belgium, and in Houston, Texas, that will be coming online very soon, where we can make sure we can do cryopreservation for your leukopak. We can also do tech transfer if you have already a cryopreservation protocol for your leukapheresis, or we can help you develop one. Altogether, Cryoport and Cell Matters, we are building what we call IntegriCell. IntegriCell is a new service fully dedicated to the leukapheresis-based therapies, where we do, of course, logistics, taking care of the leukapheresis when it comes from the collection center, being an hospital or being a collection center, bring it into one of our cryopreservation units, so one in Houston, one in Liège, and there will be more in the US and more in Europe. And also we are exploring with third party how we can support you with the collection. Why? And that's the main message. Because this little bag is of utmost importance. This is the starting material of your drug product, and if the starting material is not of good quality, garbage in, garbage out, you get a bad drug product. And this is what we want to avoid, especially when there is only one chance, when this is a patient giving away his white blood cells to get in return a drug product. Cryopreservation is super important. I can say so, you don't have to believe me, but this is Novartis and Kite publishing articles about how they use cryopreservation and why they use cryopreservation. Because cryopreserved in a good way, a fresh leukapheresis shortly after the collection is as good as a fresh product, with a big difference. A fresh product, especially if you need to ship it across the Atlantic, will never make it on time at the manufacturing site. And how do we know? Because we are doing the transportation. And we know it never arrives on time, because you always get complications, because you always get problems with the customs. So cryopreservation is definitely an edge to be used, and the big guys have proven it. So let's use it. It works. Let's do cryopreservation. The way we do it with the units that we want to be close to the patient is that we can guarantee that we do the cryopreservation less than 24 hours post-collection. and this will make a tremendous difference in the quality of your drug product. So basically, the offering that we have in place is to guarantee that we will be wherever you need us to be in the US and in Europe to pick up a fresh leukapheresis, to bring it into cryopreservation, do the cryopreservation, and then ship it back to the manufacturing. And Cryoport will even be there also to bring the drug product back to the patient. And the most important reason why we are doing it, it's because this is super important. For autologous patients, leukapheresis is the final shot before they can get a life-saving treatment. So we don't want to mess around. Quality is important, standardization is important, on-time delivery is important.